hello Facebook. This is Amanda Polachek. I'm the marketing coordinator here at Kearney Regional Medical Center. And we are trying a new format for news today. We are trying Facebook Live for our first time as related to COVID-19 information. We have so much information coming out all the time from local authorities, state authorities, national authorities, that we thought we would help you out with some information that we have from our hospital community and give you a better sense of what we're doing here each and every day. So I'm here today with Adrian Olson. We're going to have special guests on this program as often as we can. Adrian is our Chief Nursing Officer by normal day, but tell me about your role that you're in for the last month. You've been the liaison for our hospital incident command team. What does that mean?
Yeah, so the HICS team, like Amanda was saying, set up shop essentially about a month ago on March 3rd. And a hospital incident command system is essentially a team that is prepared in advance to take care of situations like this. So if you remember back to the floods, the big floods that happened in Kearney a while back, our hospital incident command team was working on all of the efforts to handle that emergency. And so this is a different type of emergency, being a pandemic, but we've got training that we do ahead of time so that we're ready to respond. And my role as the liaison officer is to do formal communication between our state and all the way down to our local area, and then all the way on up to the federal level. So when we need to have discussions with other institutions throughout the state or the country, I'm the one that makes the contacts with their key representatives. And we actually just got off a call with the governor and then Dr. Antone, who's our chief medical officer for Nebraska. We participate in that call once a week to get clarification on things and to ask for support and resources. We also talk with the Two Rivers Public Health Director, Jeremy, and we work with Mayor Stan Klaus and the city manager, Mike Morgan, regularly. I've got a call with them later today. So it's actually a really cool role because I get to take information from our facility back to the people who can help us to get funding and resources.
Yes. So Adrian and I just got off the call with the governor. We have another call with our team in the next 5-10 minutes.
Yep.
So we're going to try to squeeze videos like this in between, again, to kind of help keep the information as current as we have it, because things are changing rapidly.
Right.
But let's talk about your role as liaison with the city. What has the community been doing as a whole, as a healthcare community, to prepare for COVID-19?
Yes, so we have been working collaboratively with not just the city, but also Buffalo County and then the entire area that Two Rivers Public Health Department covers, and that's 7 counties. So when we realized that COVID-19 was going to be a big issue that was going to affect everybody, we started with meetings just right then to discuss what resources do we have and how can we work as a collaborative health system, not just one facility or one critical access hospital or one clinic. And so that has evolved into several different things, but Travis Gregg, who is one of our incident commanders in this hospital, he actually is heading up a coalition, so it just makes it more formal. They meet, I believe it's once a week, with a head of every clinic in Kearney, the medical clinics, and then there are Good Samaritan representatives, public health representatives, and city officials. And it's been very helpful because we know what the plan is for everyone else, and so we can help to supplement rather than recreating the wheel. We don't need everybody to have a tent to do rapid testing. We don't need everybody to be working on small siloed projects. We're working together so that we can create a bigger effort and make things more streamlined for the community, because that's who we're serving.
Perfect. And let's talk about the Directive Health Measure.
Yeah.
Again, you're getting firsthand information from the city. What is the message that the city wants the citizens to know?
Yeah.
How can we stay safe?
Yeah, that's a really good question. So in talking with officials from the city, the Directive Health Measure is something, first of all, that Kearney Regional fully supports. It's a very important thing to help people to understand how serious it is that we want you to stay at home. We need people to stay out of bars and restaurants, and the fact that we took our first step in mandating that has been very important. So the 10-person rule was the first level of the Directive Health Measure. It was a guideline. And the next step is what we're currently under, which is actually making it enforceable by law. And so bars and restaurants, salons, and health clubs, gyms, things like that, those wouldn't be open for the public. But so we're all kind of trying to figure out how to deal with that. The other part of that is what hospitals can do. And I know that Amanda was going to ask about the surgical part of what the Directed Health Measure means. So KRMC has been, and other facilities across the state have been working on figuring out the balance between taking care of patients that need care, because the world isn't going to stop spinning around us when you have a pandemic. So you have patients that still need to be cared for, and then you also need to put protective measures in place so that we can care for the people who are sick because of COVID-19, and then protect everybody else from getting sick with COVID-19. So it makes it a lot more varied, and there are a lot more components to think of. So our current, what we have been doing is what we should be doing, which is screening every patient and really leaving the decision up to the provider and the patient, because things are not necessarily just elective. There's a difference between elective and then essential or urgent or emergent. And so if the provider, the physician, and the patient agree that something is essential, the DHM that we're under allows the decision to be made by those people. They're the ones that are going to make that choice. And if it is essential for the patient, they would still be able to have a procedure done. A really good example of that would be somebody who needs a diagnostic heart catheterization. That might not be an urgent procedure right now because the patient isn't currently having, acute chest pain, or they're not having a heart attack. But it's important for the cardiologist to be able to assess the risk that patient could potentially get to that point in between now and whenever this pandemic starts to slow down. And so it might not be safe for the patient to wait a month until we aren't, or 2 months, let's say, when we're not seeing as much go on with COVID-19. We don't want things to backlog. We don't want that patient to then come back in 2 weeks and become an emergency for us. And so we're doing that. We're making sure that we've added a step actually where the provider will document what makes the justification for the procedure to be essential, and we're documenting all of that. So we've put some checks and balances into place to make sure that everything we're doing is actually necessary and is the best thing for the patient and everybody involved.
Cool. And we are seeing lots of choices to cancel surgery, though.
Oh yes, absolutely. Yeah, we're proactively changing our surgery schedule. A lot of people are, as we're saying, self-selecting because they would rather not, and so again, that's part of the patient's choice. But yes, we're not going to be doing purely elective, like plastic procedures or things that are not going to be beneficial for the health of the patient. So
yep. And so the best way for people to find out about their type of surgery is just when they receive a phone call to talk to their physician about the best plan for them.
Yes, absolutely. Yep. And then the physician can talk with the hospitals, our hospital or any other hospital, to make the decision on if that's going to be a procedure that would be allowed.
Cool. Anything else that you want the public to know about how to stay safe under the Directive Health Measure?
I would say just stay home. We're not going to have a lot of other things to do, but it's just very important to take this seriously so that we can, as you always are hearing, slow the curve and flatten the curve. But the more we can get people to stay home, it'll be better, and it protects the community, and it protects you guys, and it protects our healthcare workers.
Perfect. So we'll continue to have more regular updates, different people on to talk to you. Feel free to leave us messages or comments, and I will do my best to get back to everyone. We are here to help. We know that this is a marathon, not a sprint,
Yes.
and that we've been doing this for a month now, and it's just getting started. So we are doing our absolute best to communicate with you and to keep you safe. And so we thank you for the support you've shown us. We've had donations of food, or dentist's office have been donating
Yes.
surgical masks,
Yep.
things of that nature. So we're really grateful to the community and the city government and local government, regional government for their help and and keeping people safe, and we will continue to keep you updated as we have more information.
Yeah. Thank you.